The purpose of this press event is to announce that we have a letter which is going to be delivered to Speaker Pelosi in a few minutes that has been co-signed by 157 members of the House. It is 60% of the House Democratic Caucus. It is a majority of the Democrats who sit on the Ways and Means Committee. And the message of the letter is very simple, which is that as we get into the final stages of crafting a health care reform bill, the 157 co-signers want to make it very clear that any effort to try and tax health benefits along the lines of what the Senate Finance Committee has proposed is a non-starter for, again, the majority, the supermajority that exists in the House Democratic Caucus. An excise tax on health benefits with thresholds at $8,000 for individual plans, $21,000 for family coverage, already would have an impact on a group that is far wider than just the Paris Hiltons of the world. It will affect middle-class payers of health care, whether they're people who are part of a collective bargaining agreement or outside of a collective bargaining agreement. And we have data which demonstrates that. And certainly, since we're voting on a bill which has a horizon out to 2019, there is no question that that impact will widen and pick up a much larger group of middle-class Americans than even the folks that would be affected today. A year ago, this issue was front and center in the healthcare debate in the 2008 national election. It was something that was explicitly debated and discussed at the presidential level and at the congressional level. And I believe the American people spoke loud and clear that the option of taxing health benefits, which Senator McCain and his running mate proposed, was soundly rejected by the American people. And it based and the position that which the president articulated, and which again a lot of us running for office, which is that the middle class has borne enough of the burden of the economic struggles of this country for the last 10 years that they should be shielded from the issue of who pays for health care reform as this nation embarks in this historic moment. Again, we are in the final stages of discussion in the caucus. I would just remind everyone that 3 committees of the House reported out a bill. None of them had a tax on health benefits, whether it was the Education and Labor Committee, which I sit on, the Ways and Means Committee, or Energy and Commerce, and we have people representing all of those committees here today. And the purpose of this letter, again, is to reinforce that position to the Speaker, and certainly we're sending that message to the other chamber and to the White House that this is an issue that we want to make sure is given a big warning flag as these final discussions are entered into. And with that, I want to again introduce some of the members that are here, and we have some guests also that are going to join us to talk about this issue. Beginning with seniority, Pete Stark from the Ways and Means Committee has joined us, and I'd ask Pete to join in. Thanks, Pete.
Thank you, Joe. I think it's just very quick that what we do in the payment structure will have a great deal to do with how successful this reform program is over the years ahead. The high-cost plans are not necessarily just generous benefits. They come from high-cost areas. They come from the age in many cases or pre-existing conditions, so that the target and say this is only to people who have super generous plans is not correct. It may target people who have to pay more for their insurance, but it doesn't mean that their benefits will be any better or worse. Also, the idea of taxing the plans, talking about a 50% tax, that will get paid. The employers will reduce benefits rather than pay that kind of a penalty. And so the net result of the plan, if in fact you do put a 50% tax on some employers who provide expensive plans, will be for them to reduce benefits on the middle class. A far better way is what's been in 3200, and that is to have a surcharge on incomes, family incomes above $500,000. If you think about it, that's only on the income above $500,000. It's an amount that I think in my district, which is not a rich district, but has less than 200 people who would qualify, or would have qualified at 350. I suppose at 500 it's even less. But it is a way to raise the funds we need, and it seems to me that those who can afford it should pay more, and that's a better way to do it. And Joe, I just want to thank you for your leadership in this, and I'm sure that it will get the Speaker's attention, and hopefully this part will not be in the final bill. Thanks very much. And I guess why don't I just introduce my colleague Sandy Levin, who's going to talk to you about this bill as well.
Thank you and congratulations, Joe. This tax will not be, it is safe to say, in the House bill. And let me just explain very quickly why. The House bill is built on the premise of maintaining an employer-based system. It's also going to try to get a handle on health care costs. The way to do the second is not to undo employer-based insurance in this country. I think many of you have seen the chart that came out from the Joint Committee on Taxation that showed beginning in 13, let's take the family plans. Those that would be affected would go from 14% in 13 to 37% in 2019. They would be subject to the excise tax in the Senate bill. There was a slight modification in the Finance Committee bill, but these figures, I've been told, remain the same. I just received this morning an analysis by the Siegel Company, and let me just tell you what the bottom line is in terms of multi-employer health plans. Those that would be subject to the excise taxes that was coming out of the Finance Committee, there may be a slight modification because they modified it, but the basic fact is this, and I close with this very clear-cut figure. It would go from 24% in 13 to 68% in 2022. So the clear majority of the multi-employer health plans would be affected by the excise tax. That is why it is a bad idea. We have to control costs, but not by undermining and eroding the employer-based system that affects millions and millions of people. And that's the reason, Joe, and all of us, so many people have signed on. It's not the merits. It's not basically a response to the pressure, except the pressure to protect the people of the United States of America. And next is my colleague just a bit south of Michigan, from Ohio, Betty.